Today we are going to see about PNF, which is proprioceptive neuromuscular facilitation. So we are going to understand what is facilitation in this class. That's the aim of this class. So I hope all of you would be remembering that in a previous class we had looked into what is what are the different types of sensory receptors which are available, and what is the action of each sensory receptor. I had asked you to read about it. So today we are going to see how these sensory receptors can be stimulated and how we can use this in order to build up activity in the muscle over and beyond what is possible by normal contraction. So if you're going to look into PNF, there are many things in PNF which we are going to see. One is the physiological mechanism, which is the objective of today's class. That we'll be seeing what are the principles or procedures of PNF, like you have your manual contact, you have tapping, you have stretching. So these are some of the basic procedures we use in a PNF in order to stimulate. And the next one we'll be looking into patterns of PNF. So I hope all of you might be knowing that in PNF we do not do simple single joint movements, but we do multi-joint movements, because we believe that most of the functional activities which we perform in our daily day-to-day life involves combination of actions across multiple joints. So in PNF they do not try to stimulate individual joints, but rather stimulate patterns of movement. There are basically 4 patterns of movement in PNF, and we have techniques of PNF which we use according to the different status of muscle activity. So in case if you do not have a large amount of activity, then you use a lot of facilitation techniques. In other cases, like say for example you have spasticity or an increase in tone, then we can also use PNF in order to relax it. Not only we use it in reduce muscle work and increase muscle work, we also use PNF in sports in order to accelerate the amount of stretching we give by few techniques. You would have heard about some of the techniques called as hold relax technique or a contract relax technique. So that's the techniques of PNF. So when you say PNF, you need to understand all these things in together. So what's the objective for this class? At the end of this class, you should be knowing, one, what is the basis of stimulus and response? What is the difference between a facilitation and a contraction, or rather inhibition and relaxation? Next, we have to understand what are the different mechanisms of stimulation inhibition. And lastly, you need to understand in total what is the physiological mechanism of action of PNF. In order to achieve these objectives, we have to see five components. One is we are going to talk about stimulus and response, and next we are going to understand how these stimulus add up in order to facilitate or inhibit, and third one is what is facilitation, what is inhibition. Next we are going to understand what are the different mechanisms of facilitation. So a facilitation is not just one method. There are many methods of giving a facilitation. Some of it is called a spatial or a temporal summation, and there are also mechanisms of inhibition. You might have heard of something called as a reciprocal inhibition. So these are examples of inhibition. So we are going to learn about these ones. So first part, what is the neurophysiological base of PNF? PNF basically tries to elicit response in your muscles by providing a stimulus in addition to the normal contraction performed by the person. So whenever a person is going to activate a muscle, we know that the muscle will contract, and PNF is given over and above it. But in some cases, say for example, you do not have any muscle activity in some kinds of neurological patients, or if it is inhibited by pain, then also we can use a PNF in order to elicit response. So, what is a stimulus? What is this response that we are talking about? The sensory stimulus is what we are talking about. Stimulus can goes normally into the body through multiple channels. It goes through touch. The sensory receptors are stimulated. They are carried through anterolateral pathway and they are transferred to the brain. So they pass through the spinal cord and then they ascend above. Similarly, pressure, proprioception, all informations go along the ascending pathways. If you come to the head and face, so you have your vision and hearing. Stimulus can also be given by showing the patients what they are doing, and powerful stimulus can also be given by the command of the therapist. So in a PNF, we do not use one particular receptor in order to stimulate, but we use multiple receptors in order to stimulate the muscles. So, I hope you all would be familiar with this picture, which is about a stretch reflex. So, all of you would have observed that when we are tapping a tendon, our muscle automatically contracts, and this is subserved or mediated by our stretch reflex. So, in a stretch reflex, we give a stimulus to the muscle and we get a response to the muscle. Although in PNF, we are not going to see these kind of dramatic movements, we are nevertheless going to use sensory receptors in order to stimulate the reflex activity in the muscle, in addition to the voluntary contraction which a patient is going to perform. So we'll go slightly deeper into it. So you see here a picture of a monosynaptic reflex where you have your stimulus, and then this stimulus stimulates your receptor. The receptors stimulates your sensory neurons, and in the sensory neuron, the information is then being transferred to the motor neuron within the spinal cord. So you have the spinal cord integrating center. Why we call that as integrating center is you will have multiple sensory nerves coming and going and the information being passed on to multiple motor neurons. This is a potential place where we are going to see that a lot of changes can be brought about. Either you can increase it or decrease it. And once the motor neuron is stimulated, you're going to get the efferent sensory output through the efferent neuron. They're going to come to your target cell, which in this case is going to be predominantly your skeletal muscles, and this is what, and it's going to contract, and this is what we call as a response. Right. So when I say contraction, you might not perceivably see a contraction in the muscle. We'll be looking into what is the type of motor output which is going to be there in the coming slides. So we know that sensory stimulus goes into the spinal cord and exits out of the spinal cord through the motor neuron, but in this junction a lot of things happen. So this whole process which happens in the junction between your sensory neuron and your motor neuron is called the sensory processing. So what is sensory processing? We all normally tend to think that whenever we give a stimulus, we get a response. As in case of a knee jerk, we give a stimulus and we immediately get a response. But we should understand that many of the times we do touch our body, we see a lot of things, but we will not be getting all the time the responses. Right? So what happens is, if a stimulus is strong enough, it can produce a good response. If the stimulus is not strong enough, it might not produce a explicit response by way of muscle contraction, but it can always increase the amount of activation in the spinal cord. So we look the mechanism by which all the spinal nerves get in. All the sensory nerves send an impulse, And how the motor impulse comes out, there are two processes. The first process is called as convergence, and the second process called as divergence. Now, what is a convergence? If multiple sensory nerves are going and stimulating one particular or a few particular motor neurons, then it's called as a convergence. Now, this convergence can happen in the spinal cord. Basically, you can understand this by seeing that your sensory information from your forearm can go on to your spinal cord, and then these nerves which go in can stimulate either your flexor neuron of your forearm or the extensor neuron of your forearm. So if they all converge to your flexor aspect, it's called as convergence. And next is divergence. Now, what is a divergence? One sensory stimulus can go at the same time and stimulate multiple muscles. For example, again, a stimulus from the forearm can enter into the spinal cord, but at the same time, it might be possible to stimulate the motor neurons of your shoulder, elbow, wrist, and others. So this process by which one single neuron stimulates multiple neurons is called as divergence. So a convergence is when multiple neurons come and stimulate a single neuron. Divergence is when a single neuron gives branches and stimulates multiple neurons. So the next aspect of sensory processing which we are going to see is about excitation and inhibition. Now, it's very important for us to understand that excitation of a nerve is not equivalent to contraction of the muscle, and inhibition of a nerve is not equivalent to reduction of the status of contraction or relaxation, or it's not a relaxation of the muscle. So what is excitation inhibition? Excitation inhibition are basically processes which happen within the nervous system. So your sensory nerves sometimes are excited. They may not necessarily conduct the impulse, and your motor nerves may sometimes not give out impulse even if the sensory nerve is going to give, because it might be inhibited, right? So okay, sorry. So what we have to understand is whenever a stimulus is being given, it might cause excitation or inhibition. This happens because of EPSP and IPSP. What is a EPSP? EPSP is excitatory postsynaptic potential, and inhibition is mediated by IPSP or inhibitory postsynaptic potential. Now, I have introduced the term potential. So you need to, I hope you all will be familiar with what is the stimulus potential for a nerve and a muscle. We all know that when a nerve or a muscle is not active, we call that as a resting membrane potential, and it's approximately -70 for a muscle and -90 for a nerve millivolts. So when from -90 degree, from minus 90 millivolts, if the potential moves towards a positive direction to, say, for example, -60 millivolts, then what happens is you will get a contraction, right? So we will see that how we get that contraction. But if there is only a very, very small stimulus, it might not change as far as -60, which is called as a threshold potential. It might be slightly less than that, and it might not cause stimulus. So excitation, inhibition are primarily processes which happen inside the nervous system. So to see that, you can see here during facilitation as well as during inhibition, the opposite process goes on. But during facilitation, what happens? You can see here a graph which shows the resting membrane potential, which is the bottommost line of the graph, of the horizontal line in the graph. and the threshold is the horizontal line which you see above that. Now, whenever the stimulus is given, you can see a small stimulus is given. It doesn't reach the threshold, so it doesn't cause any response, it comes down. The next stimulus is slightly higher in intensity. It goes but yet doesn't reach, so it also fails to create a response. Lastly, the third stimulus reaches a threshold, and only when the threshold is reached, the nerve starts conducting the impulse. So this is the basis of facilitation. So you need to understand that when a facilitation, we normally don't just think about supra-threshold stimulus, that is a stimulus which can reach above the threshold. We also consider about sub-threshold stimulus. So when we say facilitation, we may not be giving a threshold stimulus, but we might potentially be increasing the amount of stimulus from the resting membrane potential. So now let's move on and see how these stimuluses add up into the nervous system. So this process, what you're seeing, it happens within the spinal cord, and on the left hand side you can see the different types of receptors. The top one is Pacinian corpuscles, the next one is muscle spindles, and the last one is Golgi tendon organs. Normally, a stimulation of a Pacinian corpuscle or a muscle spindle creates excitation in the nerve. So I have given a code of green color, and the Golgi tendon organ normally gives an inhibition, but it's not the same rule, it might change. Now you see here there are different stimuluses which are coming, but you see that predominantly you have excitatory stimulus, which is shown by two green arrows on the sensory side. Now once they go on to your motor nerves, although there are both two excitatory stimulus and one inhibitory stimulus, when they combine, they always stimulate the motor nerves. If on the other hand you see that there are two inhibitory stimulus, as in this case the Golgi tendon organ and the muscle spindle are stimulated in such a way that they inhibit the nerves, now the percentage of excitatory stimulus reduces and the percentage of inhibitory stimulus is increased. So now the output, effective output, which happens on the motor end, becomes one of inhibition. So this process by which the sensory information from different receptors and effectively from different regions of the body converge and try to change the level of activation of the motor nerve is what we call as sensory processing. I hope you're clear with this, right? So before going further, we will just summarize what we have seen till now. First, we saw that basically in a PNF, we give a stimulus in order to produce a response. Next, we saw that the stimulus can be given by receptors, and these can stimulate the motor nerves. Right? So we can activate through reflex and we can get the actions. Right? Next, we saw that sensory processing happens in the spinal cord, and the sensory processing actually works by means of convergence and divergence. You just saw how the nerves are converging and diverging in the previous slide. And then we have a sensory processing which is going on. This is mediated by two processes, excitation, inhibition. And you understood what is a excitatory postsynaptic potential and what is a inhibitory postsynaptic potential, right? And then we also saw how the information from multiple regions come together and they are going to produce a response. So primarily this is what happens in the spinal cord whenever we give a stimulus. Okay, now we are moving on to the next component, which is mechanism of facilitation. Now, what are mechanisms of facilitation? We have mechanisms by which we can excite or increase the amount of activity, which is called as facilitation, right? So there are primarily three mechanisms, but here I'm going to say about the first mechanism, which is summation. In summation, the primary idea of summation is just adding up. What do we mean by adding up? We add up information from multiple places. That's what is adding up. That's if you add information from multiple places, it's called a spatial summation. And if you give impulses very fast so that one impulse goes and then the next impulse adds to it, it's called as a temporal summation. The word temporal means time. The word spatial means space. So as we saw, there is a mechanism for facilitation. There is also a mechanism for inhibition. There are two mechanisms. One is autogenic inhibition. Second one is reciprocal inhibition. It's wrong that overflow has come under an inhibition mechanism. It's primarily a mechanism of facilitation. We'll be seeing that next. So what is spatial summation? A summation of simultaneous postsynaptic potentials by excitation of multiple terminals on widely spaced areas of the postsynaptic membrane is spatial summation. So I want you to recall about the whole sensory architecture of our body. We have information from many receptors: touch, pressure, temperature. So you have many receptors in the body, and these receptors all come from multiple places. They can come from your palm, they can come from your forearm, they can come from your arm, and all of these ones can primarily get into the spinal cord, right? And they will converge. So spatial summation is a process wherein when all these converges, how do they add up? So here you see that there are three inputs which are coming from three different regions, and when the first input comes, it will be small. When the second input comes, it will increase, and the third input comes, the amount of excitation will be more. And once it's more, if it reaches a threshold, it will conduct to the next end, and on the other end you can see that the impulses which are going on to the muscles will also slowly increase as inputs add up from multiple areas. So one might be coming from the wrist, one might be coming from the forearm, and one might be coming from the arm, and they all will go and stimulate the muscles of the arm and forearm. This is what we mean by spatial summation. Next is temporal summation, which is summation of postsynaptic potentials from rapidly occurring successive stimuli from a single area. Now, when if you are going to give a stimulus, say for example a touch and a pressure stimulus continuously on your forearm by say tapping 1, 2, 3, 4, 5. If you give it very fast, then what happens is each of the stimulus will be sending an impulse to your spinal cord, and each of this will go and start stimulating the second neuron which is there. It might be a motor neuron or it might be an interneuron, and all this will start adding up. The first one which will go will give us a small potential. The second one which will go, it will give a small potential. By this time, the amount of potential which is given by the first will slowly start to reduce, and so when the second goes on, it adds to the reduced stimulus of the first impulse. So here you can see temporal summation in action. Right? First, second, third, yeah. When third comes, it goes and activates. That's what we mean by temporal summation. So here you see three graphs. The first one, A, refers to normal action potential. B refers to spatial summation. You can see that three neurons send impulses from three different regions, and you get a excitatory postsynaptic potential. Now the last one, C, the diagram C, which is on the lower part of the picture, shows you the temporal summation. The first stimulus comes, the second comes immediately, and the third comes. So you can see in the graph, the first comes and then slowly it starts to wane, but by that time the second comes, so it adds up to the first one, and when it starts to wane, the third one comes and it adds up. So all these together finally result in a higher excitatory postsynaptic potential. I like to recall here a excitatory postsynaptic potential is created inside the nerves or between the nerves. So the next mechanism is called as overflow. Now overflow is when one muscle contracts. You can see that after the peak contraction of a muscle, the stimulus can indirectly create a contraction of a muscle which is lying close by. Now I want you to stop here and do a small experiment on yourself. So what I want you to do is I want you to keep your hand on your forehead, and once you keep your hand on your forehead, I want you to feel what is the amount of contraction in your stomach. Right. Now what I want you to do is I want you to place one hand on the forehead and one hand on the stomach at the same time. First, do not contract the forehead, just feel your stomach, how it's contracting. Next, what you do is you start pushing against your hand with your head so that your muscles of the neck start contracting. At the same time, feel what's happening to the contraction of your stomach or your abdominal muscles. So what you would see is once you have more contraction from the forehead, you will see that the abdominal muscles automatically contract. Although we are not asking the abdominal muscle for contraction, we are not bending the trunk forward, we are just simply keeping the muscle, and we have not given any instruction to our abdominal muscles to contract. But yet you will see that once your resistance here increases, the amount of contraction increases. So this process is called as overflow. So you can see that biceps is in a mild amount of contraction, flexor carpi radialis starts contracting. Now once your biceps contraction increases, your flexor carpi contraction also increases. This is what we mean by overflow. Okay, so now we have seen about mechanism of facilitation. First we saw about spatial summation, second we saw about temporal summation, and lastly we saw about overflow. Now we are going to mechanism of inhibitions. All right. So the first mechanism of inhibition is autogenic inhibition. What's autogenic inhibition? In autogenic inhibition, it's mediated by specific receptors in the body called as Golgi tendon organs. Now, Golgi tendon organs are small receptors which are lying within your tendon, and whenever a muscle is stretched to the maximum, or when the muscle contracts maximum against resistance, then what happens is the muscle contraction pulls the end of the muscle, which is the tendon, and when you are giving a resistance, we see that the bone doesn't move. So say for example you give a resistance to your forearm and your biceps muscle is going to contract, so your biceps muscle is going to pull the tendon from one end, and we are resisting the movement of the forearm, so the bone is pulling the tendon from the other end. So when this happens, what happens is the Golgi tendon is activated. Normally the work of a Golgi tendon organ is to try and inhibit the muscles which are acting. So what happens in a autogenic inhibition? During a autogenic inhibition, when you contract a particular muscle, say in this case you have contracted your biceps, if your Golgi tendon organ is stimulated, it goes and inhibits the biceps muscle. So the process by which the contraction of a muscle is followed by the relaxation phase of it is called as autogenic inhibition. Next next process of inhibition or the mechanism of inhibition is reciprocal inhibition. Now, what is a reciprocal inhibition? A reciprocal inhibition happens when one nerve goes and inhibits the other nerve. Now, when your biceps is going to contract, if your triceps is also going to contract at the same time, then your biceps obviously need to generate more force in order to bend your forearm, bend your elbow joint. So, whenever in normal circumstances, whenever you are going to contract a muscle, the opposite muscle will get inhibited. Although it's not a perfect rule, there are variations to it, and there is a need for why two muscles have to contract at the same time. But normally, if you are going to move your joints, then when one muscle, the agonist, contracts, the antagonist will be relaxing. Now we'll see that you have your biceps and your triceps. When your biceps is contracting, triceps relaxes. When your triceps is contracting, biceps relaxes. So you can see that. So you can see alternate contraction of your biceps and your triceps. So this is what we mean by reciprocal inhibition. So a nerve which is going to supply agonist muscle, if it is going to be activated, you will have a branch of that nerve which goes to the antagonist muscle, and that branch goes to the antagonist muscle via additional neuron called as interneuron. This is an inhibitory interneuron. You can see it in the spinal cord picture. There is an inhibitory interneuron. So when one muscle is contracting, a parallel branch of it stimulates the inhibitory interneuron, and that goes and inhibits the antagonist alpha motor neuron, and thereby bringing down the contraction. So these are two of the mechanisms of inhibition. There are of course certain other mechanisms of facilitation inhibition which we'll be seeing in a further slide. Next, when a PNF is, when we tell we are going to stimulate or inhibit a muscle using PNF, it is not only the nervous system but musculoskeletal system also works. However, we are not going to go in detail about how the musculoskeletal system is being influenced by PNF at the present point of time. We will see that when we are looking into techniques of PNF, especially the techniques which are useful for stretching or relaxing the muscle. During that time, how can we relax the muscle even without involvement of the nervous system? We will look into that, but we are not going to look about that now. Right? So in synopsis, we have to understand that PNF is a method to stimulate a group of muscles beyond that achieved by normal voluntary contraction. And in PNF, we use a stimulus in order to produce a response. But what's more important and interesting is these stimulus go and interact within the spinal cord by a process called a sensory processing. And during the sensory processing, you can have excitation or inhibition. So adding up of a stimulus will increase the response. We saw that you have multiple methods of inhibition like multiple methods of facilitation like spatial summation and temporal summation. We also saw that to activate any muscle, other muscles can be used by using overflow. At the same time, we also saw that the activity in the motor neuron or the muscle can also be reduced by mechanism of inhibition, especially a reciprocal inhibition or autogenic inhibition. And at this point of time, we also need to understand that there are biomechanical reasons for increasing the force or reducing the force at a musculoskeletal level. So that's what is in totality the mechanisms of PNF. If you have any doubts or clarification, you can always message me. We will have a separate Q&A sessions at a later point of time. Thank you.